Today's breaking news is coming from Canada, where actress and comedian Claire Brosseau has made a deeply emotional and controversial decision public. The 48-year-old performer, who has lived with severe chronic mental illness for nearly 3 decades, has announced that she wants to seek medical aid in dying, known as MAID, saying her suffering has become too much. Brosseau's mental health journey began at age 14 when she was diagnosed with manic depression. Since then, she has faced a long list of challenges, including anxiety disorders, eating disorders, chronic suicidal thoughts, trauma-related stress, and substance abuse. She says she has tried more than 25 medications, multiple forms of therapy, long-term psychiatric care, and even guided psychedelic treatments. Despite exhausting nearly every option available in North America, she says she has never experienced lasting or meaningful relief. In an open letter and recent interviews, Brosseau shared a raw and heartbreaking account of her lifelong struggle, including repeated suicide attempts. She emphasized that her decision to apply for MAID is not impulsive, but the result of decades of ongoing pain and failed treatment. In Canada, MAID is legal for patients whose medical conditions are considered grievous and irremediable. However, cases based solely on mental illness are not currently eligible. A planned expansion of the law to include mental illness-only cases has been delayed until March 2027. Brosseau says she fears she may not survive long enough to see that change. Her case has sparked a national debate across Canada. The central question is whether assisted dying laws should be extended to include severe mental health conditions. Medical professionals are divided. One psychiatrist points to the possibility of recovery, while another, more reluctantly, supports Brosseau's right to personal autonomy. The disagreement highlights how medically, legally, and morally complex the issue truly is. Claire Brosseau's story raises an urgent and difficult question. When the system fails to provide relief after decades of treatment, how should a patient's choice be understood? This conversation is now reaching far beyond Canada, casting new light on global debates around mental health care and end-of-life rights.